much on what's not there, but I think that if we really look at our assets, we have spiritual support, we have temples, we have churches, we have some schools. So it's about teaching people how to access those resources. There's parks, and parks are a true support for anyone that's going to. There's activities in the community. It's how do you engage and how do you access them is the true question.
Okay. And I think that's what I was asking, actually, is how do you see the community? What's out there? Anybody else?
I'm coming. On the way, I'll tell you, LA City Parks and Recreation is an active partner on CPIC. So we will have the recreational component. And, sometimes those things, just like exercise or just, getting people out the door is the important thing.
I think a lot of times the agencies and the providers underestimate the power of informal support. And I think that it's really on us to be more creative in engaging the informal supports of the families that we serve. Even if it's helping a parent contact a family member they haven't spoken to in months over an argument. These are the people that are still going to be in the family's lives even when we stop seeing them, even when they stop being medical necessity. This is what we do to ensure that the family does not crumble or fall apart when we pull out. We have to strengthen those informal supports, whether it be the pastor, the minister, the preschool teacher, the elder in the community, anything like that. That's really vital in the work that we do. So making families really collaborative partners in the services we provide.
I think it's important to be very intentional about building community. Actually, in Spa 4, I think we probably have more resources than most of the other spas just because we're centrally located. But our communities are fragile, largely because of the huge demographic changes that have happened in Los Angeles over the last 20 years. That, just to give you an example, when I first came to Church Epiphany 7 years ago, we didn't know anybody, so we took pictures and we put them up on the wall and so to identify, and I said, for me. In truth, everybody else was going to that wall and they were looking at those names and saying, oh, that's who that is. Now, they had been going to church there for a long time, but they never knew each other, never really knew each other. And that was also true in our first efforts in the health. We had a health promoter, and the idea was that they would build on the trust networks. Well, in fact, people didn't trust each other. And again, that may be just in my neighborhood, but I think that's probably true in most others. So where there are parks and churches and things like that, don't take it as a given that those networks are strong. I think be intentional about rebuilding those networks. They can be strong again, but it's going to take some work.
One of the things that we've heard earlier are the stressors in our communities now, especially in the Antelope Valley, is hardest hit by the housing collapse. We see a lot of families, I see walk-in patients almost several days a week. They're experiencing a lot of stresses in their lives, meaning they lost their jobs, they lost their houses, what do we do? And then, of course, there are cultural factors that, I don't really go to a therapist, why am I here? So, the first thing that we do is to normalize and acknowledge that they're seeking help. Kind of normalize that, yes, it is okay to ask help. This is the first thing that people have to build their strength, meaning it's okay to ask help. It's not that you're a weak person for asking help. And then we offer them how to navigate the system. What are available resources in the community? And then what can we offer you? And what can you do for yourself? It's a collaborative model, meaning you don't just ask help for somebody to fix you. It's like not the fixing effect. It's you to help yourself. We're just there to help you. So it's you always to help yourself. And I think this is a very, very strength-based model.
Thank you.
One of the things that I'm a case manager from Fountain Mental Health. These are my colleagues, and I have some clients here. One of the main challenges is working with the client because there's a lot of negative self-talk. Another main factor is the lack of support from their own families because they're not educated on what the client is going through, And a lot of times the client does not understand the different processes that they're going through. One of the things that we do as case managers is we try to help them laugh. There's a meditation class group that's offered. We also have a healthy living in Spanish, and we try to get them to smile. In my case, I try to discuss different stories of empowerment for the clients. For example, during the AIDS epidemic in the early 80s, Brazil had a large population of people with AIDS, just like we did in the United States. But in the United States, the families were placed on quarantine, and those clients were dying faster. Now, they didn't know why were the people in Brazil living longer. Well, they realized that they had more community support, and a lot of people would go to them, talk to them, and encourage them. And I think that's a big factor in dealing with depression, to keep the hope. Also, eating healthy and exercising is another component. Thank you.
Thank you.